Okay, why do I hear echo? And maybe it's just me. Okay.
I
How
don't
are
hear
you?
anything.
Okay, well, maybe it's just me in my ear. How are you?
I'm good in yourself.
I'm good. I'm good. How was your week?
Restful.
I'm jealous. Can I just
Yeah.
say that? I'm jealous right now. Because somebody is doing too many of all of the things that somebody with me would be me. So much so that I'm sending out W-9s. Folks is about to get employed.
All right. Good.
I'm about to be one of them black-owned businesses. Everybody about to get a check.
All right. Look, creating
Uh,
jobs ain't nothing wrong. I'm sure the state of Ohio will appreciate it.
yes, exactly. But good. I'm glad you got some rest. Yes, 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 yes. So much so that I've been seeing all the things that you've been posting or sending me. I was like, oh, he got it. Thank you very much. I appreciate it all. All right, let's get this party started. Welcome, welcome to our Saturday morning tea, where we discuss health information, news, education, certification tips, restfulness and self-care, and hiring people and entrepreneurship and the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button. Okay, I hear the air conditioner unit going on. I hear so many things in the background. I don't know if y'all can hear that. If I do, I'm sorry. Anyway, I'm
I can't.
Clarice.
I
Okay.
got
I'm
my own
like,
fan in the background, so
right. Oh, remember that one day we was like, what is that noise? It was your fan.
yeah.
It's like, what in the world? That was a long time ago. But anyway, I'm Clarice Warner. I'm the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. Now, let me ask you, do you really know what it takes to be a certified marketable medical coder? Well, before I introduce my co host, let me share with you information on a free, yes, free 99, free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey, okay. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, check out the video description for the link. So, joining me today is my partner in success. Yes, Miss my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Hello, everybody. My name is Jesse. I live in Philadelphia, Pennsylvania. I've been in healthcare as an LPN for a very long time. In 2014, I left the bedside and transitioned into risk adjustment medical coding during the pandemic. In 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
Oh, and isn't it a wonderful, wonderful world? All right, I was listening. I said you better be specific about what type of health information you've been providing in the revenue cycle. Be specific. I love it. All right. So before we jump in today, let me remind you that this is a conversation between the two of us, but also a conversation with you. So you can join in and add to the conversation. Don't be shy. Don't be shy. Those who are regulars, you already know, they're not shy at all. Your opinion matters and is welcomed here. So, friends, use the chat. The chat is your friend. That's where you can join in on the conversation. Now, if you have a question, please type Q first so that we know it is a question for us and we don't miss it. We always want to make sure that we answer all of the questions that we have going on. So let's see who's in the house today. Good morning, Carolyn. Good morning. Welcome, welcome. All right. So, okay, let me get us started. So for those who are just joining us or watching the replay, um today we're talking about HIPAA breach alerts. What you need to know. This the background and this whole story has just been perplexing to me. I'm ever since I first got it, I'm like, huh? But anyway, we'll dive into that in a minute. But first, we have our church announcements. Yes, 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 yes. Oh, look at you. Wait a minute, sir. You ready? I didn't even hit the play button and I see a fan. I need to get my fan. I need to remake the fan. So we can be joined together. Oh, oh. Mm, 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 mm. Yes. Can't have a church fan without MLK. Not at all. All right, all right. Not me. So I pretty much do not have any church announcements, but I needed to hear the music.
You don't, I do.
Well, wait a minute. Hold on. Let me turn the music down. Hold on. Let me turn the music down. Okay. All right. Mr. Jesse, go ahead with your church announcement.
Well, last week after our show, I got a comment from one of my subscribers to my YouTube channel about our subject of virtual nursing.
Mm-hmm.
She works at a hospital. She was a floor nurse until the pandemic, and she transitioned into she's doing CDI. But she
Okay.
said that her hospital is currently trialing virtual nursing, and it's a small um, small health network. They have two hospitals, one in Maryland and one in Delaware. And currently, the nurses work 3 12-hour shifts. They work two on site, and then one of those shifts is a virtual shift. And they're installing more monitors in each of the patient's rooms. And the virtual nurse will do the admission history, they'll do patient education, and any kind of like discharge instructions. And what it does is she said that it it increases the number of patients that the floor nurse has because they don't have to handle so much the admission or the discharge. And
Okay.
she said she's not exactly sure how she feels about it. So I asked her, I said, well, what size of of the hospital is it? So she said it's a 99-bed facility, and they do like they don't do like extensive surgeries.
Okay.
So and then this is currently being trialed on their surgical unit,
Okay.
which I thought was interesting. But it's a smaller hospital, so they're not doing any kind of like transplantation or anything like that. So
Absolutely.
I
Okay.
thought that was interesting. Okay.
Yes, yes, and very timely. And I thought about how they are having people they're having like medical care at home where they are technically not seeing them in the hospital or not housing them in in a bed in the hospital, but but allowing them to I don't think it's rehab though. I think it's because they have the monitors and they have all of the things and they have either a nurse there or and physicians come by or all of the things, but they're having it set up where it's in the people's home. I know that was a new trend, and I can kind of see where that virtual nursing could work there. I don't know the acuity level of those types of patients that they're kind of transitioning in the house, but I can kind of see some of that um, in that kind of setting, maybe. I don't know, but the article did mention about with the virtual nursing that it will allow the nurses to increase kind of the number of patients that they can manage because they have additional help that is there virtually to do some of the tasks. So it did talk a little bit about that. But that's interesting
Yep.
um, that someone reached out to you and said, "Look, they watching us. They watching us." No.
I'll, her name is Renee. I'd like to thank Renee for
Well,
being a
thank you,
subscriber and
Renee.
also participating.
Yes, thank you, Renee. We appreciate it. Yay. The coding nurse subscribers in the house. Love it, love it, love it. Okay. Well,
Oh, and she says she watches the Saturday morning tea every week.
yay. Well, welcome, welcome. Thank you. And feel free to join in. Don't be shy. Don't be shy. Come
Definitely.
on in. Come on in. Okay. Let me stop our music, stop our banners, and get into this. Okay. So, well, let the tea spilling begin, shall we? So, again, welcome to the Saturday morning tea. And today we're discussing um, what are we discussing? HIPAA breach alerts and what you need to know because my notes said something totally different. Okay. So, um, yeah, yeah. So, we looked at a couple articles from the HIPAA journal. And the first one talked a little bit about, or a lot of bit about, I won't say a little bit, a lot of bit about um, two employees who were terminated for privacy violations. And we're going to get to them. But first, I wanted to kind of level set the information about HIPAA. And I know we've probably heard about HIPAA. We know a little something, something about HIPAA, but I wanted to make sure that we knew all of the things around HIPAA and particularly around breach notifications. So, the breach notification, it's actually a rule. There's a rule behind all of the things. Wait, there's a comment. Let me get good morning, Sharon. Good morning. So
Good
there's a
morning.
rule. The rule was introduced in 2009 and it was part of the High Tech Act. And this rule requires covered entities and business associates to notify affected individuals, the Department of Health and Human Services, and in some cases, the media when a breach of unsecured protected health information occurs. Now, um, covered entities are kind of your first line. So, say you are a hospital system and you are receiving directly um, health information. So, patient registers, or you're in a physician office, patient is coming in for services, they have registration, they provide all the information, you have records, you have PHI pretty much given to you directly. And you're housing them, and you are the owner of the uh, PHI per se. Business associates are those people or groups or organization that are tethered off of the covered entity. So say you have someone else doing the revenue cycle portion of your business. Well, that would be considered a business associate. And there has to be a business associate agreement that incorporates all of the things related to HIPAA, what they can and cannot do, who's responsible for the notifications, blah, blah, blah. So anytime the covered entity kind of, and it allows the opportunity for shared PHI to for the course of business to for operations. Um, and but there has to be that business associate agreement signed by the parties. So again, the covered entity has a role in notification as well as the business associate has a role in the notification. Um, and so really the notification is not just about following the law. Of course it is because it's a rule, but really it's about maintaining the trust with our patients and protecting their sensitive information. And as providers of such services, we have that duty. We carry that duty. So, um, so what exactly constitutes a breach under HIPAA? Well, it's the acquisition, access, use, or disclosure of unsecured protected health information in a manner not permitted by the HIPAA privacy rule. So this could be anything from a stolen laptop containing patient data to an employee snooping in records they shouldn't access. However, there are some exceptions to the rule. Am I still playing the music?
I don't hear.
Oh, I was like, I heard a whole large sigh. Okay. um, there are some exceptions to the rule. For instance, unintentional access by an authorized individual acting in good faith doesn't count as a breach. Remember, it's about unauthorized access or disclosure that compromises the privacy or security of protected health information. So there are some time frames for reporting breaches, and timing is crucial when it comes to breach notifications. The general rule is that notifications must be made without unreasonable delay and no later than 60 calendar days after discovery of the breach. But here's a key point: the clock starts ticking when the breach is known or should reasonably have been known, not when it occurred. So it could have occurred years ago, but then was just discovered yesterday. So at that point, yesterday is when the clock ticks or starts ticking. For breaches that affect 500 individuals or more, again, you must notify HHS concurrently with individual notifications. For smaller breaches, you can submit an annual report to HHS, but don't wait on notifying affected individuals. So there are two kind of ways that you can report. So there's an annual report that is sent to Health and Human Services of breaches, and you can put like the smaller ones that may have that you have discovered. And for our compliance professionals, you already know should know all of this. So you would submit that report with the smaller ones. But then if there's larger breaches, then there's an additional report that you submit to them immediately about what has happened with that particular breach. And you still add that information to the annual report, but you have to contact them immediately about those. Um, and then your 500 or more also requires notification to the media. Um, so for individuals, you need to provide written notice by first class mail or email if the individual has agreed to electronic communication. The notice should include a description of the breach, the type of information involved, steps the individuals should take to protect themselves and what you're doing to investigate and mitigate and contact information for questions. For HHS, you use their online portal to submit your report. And I should have put a copy, but the online portal has fields that you must complete for the report that kind of asks for all of the information similar to what you report to the individual, and you would submit that electronically directly to them. And then again, if the breach affects more than 500 residents of a state or jurisdiction, you must notify prominent media outlets serving that area. Again, it's about transparency and allowing individuals to take the steps that they need to protect themselves. Your business associate responsibilities have expanded since the omnibus rule of 2013. So if you experience a breach, you must notify the covered entity no later than 60 days after discovery and provide as much detail as possible, including the identities of individuals affected if known. Remember, your business associate agreement may require faster reporting, so always check that. And again, that is the contract that you have with the covered entity. So theirs may be more stringent. And of course, you need to follow the contract that you have with them. Um, Also, even if you're handling the notifications, you must keep or you should keep your covered entity in the loop. Again, communication is key in these situations. So they're not blindsided that one of their business associates has had a breach and the information is out before they know and they can't um, craft the narrative. So, partners in business, you need to make sure that you're communicating what is happening. Well, here's another piece of information that you need to know, that you have state laws versus HIPAA requirements. And we've talked about this on several different things. State laws oftentimes differ from federal law. So in this case, you may have states that have their own breach notification laws, and they may require notification within 30 days, not 60 days. And as health information professionals, again, we need to be aware of both the federal and state requirements and follow the stricter standard. So it's always recommended to kind of create, especially if you're living like here, we're in a tri-state jurisdiction where we have Ohio, Kentucky, and Indiana. And so it's good to be able to know what the state requirements and state rules are in all three of those states. And so if you're in you're an area where you have more than one state that you're kind of looking at, it's good to kind of keep a guide for your organization so you know what is needed and what is necessary and what the rules and requirements are for each one of those states. So, also, when in doubt, consult with legal counsel familiar with both HIPAA and state privacy laws. So, some common pitfalls and how to avoid them. First, delay discovery. So, ensure you have robust systems in place to detect breaches quickly. Second, incomplete risk assessments. So, thoroughly document your analysis of the potential risk. And your organization should have a risk assessment done every year where you're going through and determining what areas you need to focus on. And privacy and security should always be part of your risk assessment. And then you um, need to look at over notification. And while it's better to err on the side of caution, unnecessary notification can cause undue alarm. Also, poor documentation. Keep detailed records of your breach response process. And finally, failure to learn from the incident. So, you should use the event as an opportunity to improve your safeguards and procedures. Best practices for breach responses and prevention. Well, first, again, a detailed written breach response plan and practice it regularly. So you should those in those areas where well, really, everybody in the organization should have HIPAA training and should understand the process. But making sure that that process is documented and is practiced so folks understand what is required, what they need to do, who they need to tell, etc. Your and then next, of course, train your staff, and they're your first line of defense. And then encrypt your data. Remember, a breach of encrypted PHI doesn't require notification if the encryption key wasn't compromised. Also, conduct regular risk analyses to identify vulnerabilities and foster a culture of compliance. Again, encourage reporting of potential incident without fear of retaliation. Again, we want to make sure that we're following the spirit of the law when it comes to HIPAA, but really it's about our patients as well and their privacy. And they trust us to um, handle that and keep that information safe. And so we need to make sure that we're honoring their trust. So, um, those were just some key things to kind of level set our conversation. Mr. Jesse, did you have anything you wanted to add or say?
Just that there are a lot of safeguards that are built into the system, and a lot of things, I mean, and a lot of, well, I would love to see if there was any data around the most common types of breaches.
Hmm.
Like, is it, end user error? Did somebody hack into the system? Like those kinds of things would be really, really interesting. And, because you used to hear, and you don't hear it as much now, you would hear that somebody had a laptop stolen or somebody lost a laptop. And I remember when I used to work for a company and I used to have to travel to do reviews,
Hmm.
and I had to fly. Like it was, I had to sign off on the policy that you are not allowed to check the laptop in check luggage. You have to carry it as a carry on, because
Hmm.
if what if your luggage gets lost? What if
Hmm.
it's just then that, because you have all of the patient files in there, all the patient information you need to when you get to that facility to do your review.
Hmm.
So there's a lot of safeguards built into the system, but I would still like to know, like, what are the most common breaches, because it seems like now it's just like systems that have been hacked
Hmm.
by almost like professionals.
Hmm. Well, remember, a lot of systems are now encrypted, so you don't have to have that notification if it's encrypted and the key wasn't compromised. So that's probably why we don't hear a lot about the lost laptop or the lost whatever, because it was probably should have been encrypted. A lot of things are encrypted in most of our systems now. But I'm like you. We see, well, here lately we've seen a lot of breaches where hacks have been involved. But I still hear some, and not that they're based on notification. It's just have word on the street where somebody is telling somebody something about somebody who was in a facility or went to a doctor's office or whatever. Those are breaches. If you have no need to be in somebody's record, if you're not, uh, it's operations, it's TPO, treatment, what's the P? I can't think of payment and operations. If you're not involved in any of those areas, then and the person that you're talking to or providing information about is not involved in any of those areas, you don't have, that's a breach. And long are those days where Sister Johnson will be in so and so records. Let me tell you, so and so is in the hospital and they got that one disease and da da. That's a breach all day. So I know people uh, are. when they come into when they are employed initially in these facilities, they are getting that training, and most organizations have like annual refresher training. And I know from organizations that I have been involved with, HIPAA, privacy, security is still part of that annual training. But do people really understand that you having a conversation with somebody who doesn't have any need to know about anything within that for that patient, that's still a breach. And um, you could lose your job for that, uh, and among other things. So,
Where, where I worked most recently, I think I might have talked about this, before, because I think a lot of people forget that HIPAA has a lot of little rules.
mhm,
And one of them, and I thought back to one of them, is the minimum necessary.
mhm,
And where there was a situation where this provider was reaching out to a person who was not assigned to this particular patient in terms of chart review. And what I said, because another uh, employee had contacted me because they were upset because they found out that this other employee looked in had looked into the record.
mhm.
And I said, well, technically, that is a HIPAA violation because she has no reason to access that record. She wasn't assigned, and she's not. That's assigned to you. That's really That's not even a low level because they don't have low level violations. Either it's a violation or
It's
it's
a
not.
violation or it's not. It's real black and white.
I said, so that is the HIPAA violation, honestly.
Hmm.
And I told her, I said, it's up to you how you want to handle it. I said, honestly, I said that's why I don't, unless somebody asks me specifically, or they say, can you look at this case, or can I share my screen and show you this? I don't go chasing waterfalls. And
Go chasing what? Okay.
and a lot of people don't understand like that minimum necessary, and if
If
it's
you don't
not.
have a need to know,
Thank you. And so many
uh-uh.
people. And now, thank goodness, they can really track. They can see who logged in. That's
Mhm,
why you have all, especially with celebrities, when they're in the hospital, they can
mhm,
see, oh, well, so and somebody in X-ray accessed this person's record. Wow,
mhm,
the
mhm.
person didn't even have an X-ray. And
Exactly.
next thing you know, look, they're without a job. But
They walking them out.
mhm,
Yeah, yeah. Well, then this kind of sheds light on the other article that we had that Mr. Jesse brought to my attention, um, about a breach that occurred at Mass General Brigham. It said was formerly known as Partners Healthcare. So, I'm still. So let me start with what happened. So on April 4th, 2024, General Brigham discovered that two employees had allowed an unauthorized third party to perform some of their job duties. Okay, that's where it stopped me right there. I'm trying to understand this right here. Well, I got all the other stuff. I'm still trying to wrap my head around. You know what? I don't even want to do that. Let me call my friend. Look, hey, what you doing? Can you go ahead and handle what? Where is that? I guess at Mass General. Well, I guess not anymore. But who was doing that? Or then the other thing, other scenario, I thought, okay, you know, we do talk entrepreneurship and all of that, but you got to do it the right way. You can't just be on your own saying, "Oh, well, I'm gonna let you learn how to do this with the other people's stuff." Who is doing this? Where
exactly.
they do that at? You have to have a contract with them that allows them to provide information with you, and then you have to have a contract with the person that you are hiring. Either there's a business contract, there's an employment contract, there is some kind of contract for all of the parties to be safeguarded against this kind of foolishness. I said, well, what in the world is happening? Yes, even with the outsourcing, there should be a contract. They done did their own homeboy outsourcing where it's like, yo, dude, I got some overlap. I need to take a break for a minute. And so I'm gonna need somebody to come over here and just do some of the things. I wonder where they remote employees. That's a whole other like I said, I got stuck right there. Like, I'm just gonna give somebody my duties. Like, you know what? Yeah. But then, I thought about because in the educational space, it's a teaching training moment where you have people come in, but that's all contracted out as well. So there is a contract with the organization that says that this person and for most of these school programs, I mean, there you have to have a background check, you got to have, vaccines and all of the things before you can come in and do any type of work in these facilities. And yes, the work that you're doing, because I think the initial posts to these articles were with someone who was saying, giving free services. Well, yeah, they're providing free services, but again, it's all under contract and it's all under the auspices of teaching. So, yeah, and education. So I don't know. I got stuck right there.
It's just,
It's mind-boggling to
it
me.
really is because I'm like, what? My first question is, what were you thinking?
Right.
I just don't get it.
don't get
I
it. I don't get it at all. Like, let
some
me
people
break
are
you off a
cool.
little something, something. I'm just really tired, and then and they didn't go into enough details. I need to know the details behind how this worked. How did this pop off for real? That's what I needed. Well,
Exactly.
anyway, so this breach potentially exposed sensitive patient information between February 26th and April 4th. The type of information at risk included names, addresses, medical record numbers, dates of birth, phone numbers, email addresses, and health insurance policy numbers. And for some patients, social security numbers and financial information were potentially compromised. So again, what's particularly concerning about this breach is that it was an insider threat. So it wasn't a cyber attack, but a case of employees, and not just one, but two. And did they use the same person? Like, oh, I got this friend that can go ahead and you go on take your break. They can work on your stuff too. I mean, I'm still trying to understand what the scheme was.
It sounds like this is just my mind. Sounds like they had their own externship program.
Or something.
Oh, you do that? Well, I know somebody. I can get my neighbor to do it too. Now, how do you do it?
I'm like, what is going on? I'm like, oh my God. So, Mass General Brigham took swift action, terminating the two employees involved and offering 24 months of credit monitoring and identity theft protection services to affected patients. But uh, Mass General, and I don't know, my understanding it's a very large organization with several facilities, but they're not new to large scale HIPAA violations at all. They had a whole corrective action um, plan that they had with HHS and OCR years ago. And they were also part of, I think there were 5 or 6 other hospitals that was allowing them to film patients without their with the consent for one of those TV shows. And so they were part of that breach where they had to pay $1 million for allowing for allowing the people to come in and film for the TV show. And you got folks laying in beds, and I guess you got the actors or actresses, and y'all tell them what to do, but you got regular people in the hospital laying in the beds where y'all filming all around them. So they're not necessarily new to being involved in breaches over the years, but you know in cases where there's large organizations, like they are targets. We know that here with these more recent cyber attacks, they are targets because of all of the sensitive information that they handle. I mean, you get into some PHI, you got everything. You got somebody whole life, everything.
Now PHI is worth more than money.
Yes. 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 So let's see. Also in June of 2024, Mass General Brigham reported two breaches to HHS, Office of Civil Rights, one affecting 3,659 individuals through their health plan, and another affecting 655 individuals through the hospital itself. So again, it's a lot of concern for this particular organization, and their practices and policies um, alike. So again, it's important to remember that large healthcare systems has likely experienced numerous smaller breaches that didn't meet the threshold for public reporting. So again, there's probably all kinds of stuff going on that we have no idea about. Hopefully, there aren't more employees in this employee chain providing this the same service to the community. Because this is crazy. Um, but the healthcare industry as a whole has seen a significant increase in data breaches over the past 5 years, with insider threats, phishing attacks, and ransomware being the common culprits. So, a couple of things we can learn from this experience. One, don't who you let do your job. I don't understand that. Um, but it's the importance of robust employee training and monitoring, especially for those with access to sensitive information, the need for stringent access controls and regular audits of who's accessing what data and why, the value of quick detection and response. Again, they identified the breach and took action promptly, and quickly released those employees, and I guess they offset employee as well. I'm surprised folks are not r- being charged criminally for this. I'm that may be in the works as well, because this is just all it's all wrong, all bad, all wrong.
It
Um,
is.
and then the ongoing nature of privacy and security threats. Even well-resourced organizations face these continuing challenges. So again, as health information professionals, we have to stay vigilant and continually reassess and improve our privacy and security measures. So, yeah, just wanted to kind of talk through some of the things that we've seen as it relates to HIPAA. Wanted to get a level set so you understand at least about what's required for breach notifications and all of those things. Um, and just wow. I want to know more. I don't even have to know the who. I just want to know what was the scheme? What did they think they wow. Like, let me give you my ID so you can come in and do I just it's way too much. I'm surprised. There has to be I think it's more to it than just them losing their job.
I don't know. I would think that that sounds like some type of remote work.
It has to be. It has to be.
And I don't know because right now, like I kind of side eye any place that hires people, and I would think that a hospital system would provide equipment. So that's why I don't even know how you would even attempt to do that. I just don't know, and I'm glad I don't, because
Right. I'm
but
like, "Oh my goodness." Yeah, I think it's more than likely has to be because the person supposedly didn't have any affiliation with the hospital at all. I'm like, "Wow." I just ooh.
well, look, they got their cousin that did 2 semesters of nursing school.
I cannot. They CDI professionals now. So
Exactly.
we needed to learn this part of it. So now we got it. We can roll. Oh my God. Oh my God. Well,
That's
yeah.
crazy.
That is crazy. I didn't understand. So I'm wondering, like, for those of you all viewing, here's some questions for you. Like, how confident are you with your organization's breach response plan? Are you familiar with it? Do you know anything about it? What challenges have you faced in implementing HIPAA breach notification procedures, particularly if you're working in compliance or privacy and security? How do you balance prompt notification with thorough investigation? Ugh, I remember we used to see all kinds of stuff, and we would get um notifications, and it's like be like, oh my God. Once we got it, and it was always okay, how many? What's the number? What we gotta do, because it can go left real quick. Um, Depending on how many. And I remember we used to hear a lot about, like you said, the laptop thing, destruction, the destruction policies, and how people were destroying, when it was time for, the record retention, and it was time to do the destruction piece. Well, folks didn't have a tight handle on what that looked like. And some ways in which they were destroying records, ma'am and sir. No, you don't just take a bag outside and put it in a dumpster. You don't do that. Um, and so some of the policies had to be shored up to include proper destruction methods and procedures. But we would run into a lot of that, like, oh well, we was on the time, we knew the or the retention policy was coming due. We had a little time, so we just grabbed everything, put it in the bag, and just got rid of it. Absolutely not. So
Well, one of my friends worked somewhere where they 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 had um they were storing records off site, and they were having problems from the get go because there was some kind of speculation that it was like one of those. It was a contract that was just like given to somebody because they knew somebody, but they
mm,
weren't really skilled at their job.
mhm.
And later on, she had to request records that were off site, and they couldn't find them.
Oh my God. Oh God. Wow. I don't understand.
I don't know.
Yeah, it's a lot. And then lastly, what strategies do you use to prevent HIPAA breaches in your workplace? Again, would y'all tell y'all friends that they can't be the community reporter about all things happening in the hospital?
Look, the strategy is stay in your lane.
In your whole lane.
And another thing that gets me is like these. I love to hear because like full disclosure, I do participate. I watch messy YouTube sometimes.
Not messy YouTubes.
And what gets me, I crack up every time. These people, when they start fighting with each other, they kind of go below the belt and they want to they call them health reads. And how are you like working part time at Subway and somebody is accusing you of a HIPAA violation? That's not how that works.
Oh my God.
If you have never if you have never ever seen this person's medical records, anything that you say that they have or don't have, that's speculation and that's your opinion. How you that's a HIPAA violation. No, it is not.
You hear, and you do hear that all the time. Like, y'all know about HIPAA. You know about HIPAA.
Exactly.
Like, but do you know what HIPAA is?
No.
Like, what are you talking about?
And can I tell I get so tickled because they are serious too. It's like I'm gonna call the law. I cry.
Oh
That is my
my
indulgence, and I'm telling you, sometimes I am screaming. I'm like,
God.
as you say, bless their whole heart.
Their whole hearts.
They're out here protecting medical records. Do you hear me?
That is funny. Oh my goodness. That is funny. Oh my goodness. Well, yeah, that's all I really have for the day. Just talking a little bit through
That's enough.
privacy.
I mean, 'cause it people don't. HIPAA is very, very, very extensive and expansive.
Expensive.
So,
And
and too,
expensive as well. Because them
I
fines
mean,
is no joke.
and they have a policy for everything.
Hmm.
And like a lot of people, like it's even like the privacy rule, the security rule. There's all kinds of rules
Hmm.
that people just really just either don't know about or they just gloss over, thinking that it's just talking about your aunt's foot fungus in the elevator. No,
Mm-mm-mm.
it's more than that.
Crazy. Crazy. All right, all right. Well, for the good of the order, I'll give y'all some time back. How's that? All right, all right. Let me present my slide. All right, all right. So, are you thirsty for fresh perspectives on healthcare revenue cycles? Well, becoming one of the tea sippers, you'll join a community of sharp minds who savor the complexity in the healthcare revenue cycle. Why sip alone when, where's my tea? Why sip alone? When you can steep in knowledge together. Come, let's spill the tea on industry insights. So here's what you can expect as a valued member of the Tea Sippers: exclusive healthcare insights so you can gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access. You can be the first to receive expert insights and guides, ensuring you stay ahead in the ever evolving healthcare industry and even those things with comedic value as well. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And community connection, which is my favorite. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So, by supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the Professional Reimbursement Network, LLC, a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So, thank you for considering becoming a member of the Tea Sippers. You can check out the link in the description of the video. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. You can also check out the link patreon.com/Clarice Warner, the girl with the pearls. Yay. Y'all quiet today.
And I was just saying, like before we closed out, I just wanted to say I really miss our on the street correspondence. She must be
Yes, like
busy. Yeah.
everybody's quiet. Well, it is a holiday weekend. I guess
Mhm.
maybe folks are holidaying it up. But you know me, I always if the time is there, I got the time. I'm gonna be here for the Saturday morning tea because as we all know, news never stops.
Never.
Information never stops. Okay, well, thank you all again for joining the Saturday morning tea. Let me move this. Or checking out the replay. Let me ask, was the tea spilled today? Did you learn something? If so, put your teacups in the
Oh, she's here.
oh. She was like, I was bless her heart. Well, you was missed. You were missed. Um, if this information was valuable for you, help us share this message with others by sharing the video and subscribing to the channel. Be sure to follow us for more information on all things health information. Yeah, I see your teacup. Yay. So follow us for all information on health information, compliance, revenue cycle, and medical coding. And as you leave, don't forget to hit the thumbs up or like button. Hey, look at even the quiet ones putting their teacups in. Also, check out the Coding Nurse channel on YouTube. Mr. Jesse gives some gems over there, so check out his channel as well. Mr. Jesse, did you have any final closing thoughts or words for?
No, it's just look, this is totally off topic, but it's kind of related.
Okay.
Can I tell you, look, we all got to keep up with technology because can I tell you, I had a Squarespace update that turned me every way but loose, but I tell you, it pays to have a network.
Mm-hmm.
Cause man, 'cause they were like, "Oh, well, we're updating our something on the back end, so you had to reestablish all of your automations."
Okay.
So, and they even had a video plus written instructions. I'm like, "Oh, now what they told you to do was easy." But what they didn't tell you was how you had to go back and reconnect all your other third party connections. And they ain't tell
Oh.
you that.
It's
So
always the fine print, right?
yes. So thank goodness I have some people who could help me on the back end and we got it together because I'm like, "Oh,
Yay.
this is not
Crisis
working."
averted.
And I'm like, wait a minute, I got all these. I mean, I have like emails that go out every day soliciting them. I mean, all that's automated. I'm like, wait a minute, I need something when these people click. They gotta have something to click too. I'm like, oh, but crisis averted. Praise the Lord.
Yes,
Yeah.
yes, yes.
It takes you gotta have a team. That's all I'm gonna
You
say.
have to have a team, and it's great to have a team and folks that can help you on all ends, all of the things.
Mhm.
Because sometimes there are things that you don't even think about, and you'll be like, "Oh, I never even knew. I didn't even think about that." And then they can say, "Well, yeah, you got to have X, Y, Z," and you're like, "Oh, okay. Let me get that. Let me get that together."
And I'm glad. And I'm and so another thing. So then I reached out last week, the week before,
Hmm.
to the guy who helps me with Python because I'm like, wait a minute, this is not like this script is not working. So he was able to help me, and the thing is, it wasn't working because I wasn't following the directions.
Okay, not following directions.
Exactly. I'm going. Now, it didn't say it, do it. I even look. I even like checked Chat GPT, and did I do what they said? No, I did not. And I'm surprised that it wasn't working. But anyway, he
User
got
error.
yes. So and when he wrote me back, it was exactly what Chat GPT said. I'm like, oh, okay. Well, you got to listen. You got to follow what they say. So then, so I got it working. All's well with the world. So I just reached out to him because I sent him some information, and he was like, "Oh, well, I'll hit you back. I'm out of the country. I'll be back like this was like last week.
Hmm.
I'll be back like not even next week, the week after." So I'm like, now imagine if I had waited, I'd have been all messed up.
All messed up. All messed up. So we just gave you like a little glimpse of some of the things that happened in the meeting after the meeting.
Yeah,
It kind of goes down. And this was just a
surface.
surface run. Because there will be extensive details in the meeting after the meeting
Oh,
with
and I
more
got more.
questions.
We definitely gonna save that for the meeting after the meeting.
Absolutely, absolutely. So if you are interested in knowing all of the things that happened in the meeting after the meeting, come join us in the Tea Sippers. So again, this has been a great session today. See you tea sippers at 10:15 a.m. Eastern Standard Time. Again, thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, have a safe Labor Day weekend. As everybody says, don't labor.
That's right.
Lay around, get some rest. Get some rest. I know I need some. All right. Talk to you soon.
All right.
Bye
Bye bye.
bye.